Hello. Yes, so the students, I'm going to take a lecture today on geriatric health. So let us first know what is geriatrics. So in the words of Seneca, old age is an incurable disease. Sir James Sterling Rose said, "You do not heal old age, you protect it, you promote it, you extend it." Old age is a normal, inevitable biological phenomenon. There are few terms used in the this context of geriatrics. These terms are gerontology, that is the study of physical and psychological changes which are incident to old age. Then there is a term clinical gerontology or geriatrics. This deals with the care of aged. Then there is social gerontology. This is a study of instincts of humanitarian and social attitudes and the problem set by increasing number of old people. Experimental gerontology is a branch in which we research into the basic biological problems of aging, into its physiology, biochemistry, pathology, and psychology. Then in geriatric gynecology, we study the problems of old age in relation to gynec subject. Coming to the problem statement, in year 2002, geriatric population of world was 605 billion, of which 400 billion is low-income countries. By 2025, it is expected to grow up to 1.2 billion, of which 840 million will be in low-income countries. In India, in 2003, the geriatric age group population was 76 million and accounted for 7.2% of total population. This number increased to 104 million in 2011 and expected to grow to 173 million by 2025. So you can see that how large the population of the aged people is still existing in our country, and it is going to be larger and larger as the time passes. Now there are some spatial problems of this age group. That's why this geriatric group is important from community medicine point of view. So the health problems of aged are problems due to the aging process, problems associated with long-term illnesses, and psychological problems. So first we will see what are the problems due to the aging process. You see, aging is a continuous process. It starts from the birth and goes on till death. So there are always aging changes inside the body in different parts of the body, and these sometimes result in some difficulty in the life of a person. So problems due to this aging process are senile cataract, glaucoma, nerve deafness, osteoporosis affecting mobility, then emphysema, failure of special senses like eye, ear, etc., then changes in the mental outlook. Then there are problems associated with long-term illnesses, And these include degenerative illnesses of heart and blood vessels. For example, atherosclerosis, the arteries becomes hard, there is narrowing of blood vessels, there is this results in the chances of thrombus formation, the rupture of blood vessel occur, and high blood pressure is there. This thrombus gets dislodged from its formation site and may block, may come in the blood flow and may block any narrow vessel and can cause ischemia in the organ to which it is supplied. So that is a dangerous thing. Then the other chronic illness which is common in aged group is cancer. You'll find cancers much more common in the geriatric age group population rather than in young age. Then accidents, there is decalcification of bone, the bones become fragile. So the accidents very easily occur, and fractured neck tumor is the most common type of accident which result from the accidents, and this is a very horrible condition, and the person becomes bedridden, he cannot walk or move, and the life becomes miserable. Then the diabetes is another disease which creates problem in the geriatric age group. Coming to the disease of the locomotor system, there is fibrositis, myositis, neuritis, gout, rheumatoid arthritis, osteoarthritis, spondylitis of the spine, etc., which create problems, and the locomotor system of the body is affected, and person feels difficulty in walking, moving hands, doing day-to-day activity, etc. Then there are respiratory illnesses. They become more problematic in geriatric age group, and these are chronic bronchitis, asthma, emphysema, etc. And there are problems of genitourinary systems, which are very common in the old age group. There is a prostate enlargement in male people, which results in dysuria, that is difficulty in maturation. Then nocturia means increased frequency of maturation in night, and the patient has to go very frequently for the maturation, and there is urgency of maturation. That means he cannot stop or wait for going to the toilet. Then there are psychological problems also, which are specific to this age group, and these are mental changes, impaired memory, rigidity of outlook, dislike of changes, etc. So these are mental problems which usually occur in the old age group. Then there are sexual adjustment. There is cessation of reproduction, there is diminution in the sexual activity, physical and emotional disturbances occur due to this diminution of sexual activity. There is more irritability, there is more feeling of jealousness and despondency. Then there are emotional disorders also, which result from social maladjustment. There is failure to adapt, the results in bitterness. This results in the bitterness in the nature of the person. There is inner withdrawal, there is depression, and fearing of life, and sometimes even suicidal tendencies may develop in these aged people. Lifestyle and healthy aging are closely linked. By paying careful attention to lifestyle factors and adopting healthier lifestyle, the risk of diseases can be reduced. First is diet and nutrition. So diet is very important for the life, and it decides what type of diseases we are going to get, whether we are going to have a healthy life or not. So diet should be balanced with less saturated fats and oils, should contain lots of fruits and vegetables, and salt and sugar should be less, because these persons, if they have a high blood sugar level or they are diabetic, then they have more chances to develop various diseases. And similarly, the excess of salt leads to hypertension, and that is a very common disease in aged group. So they should restrict salt and sugar quantity in their food, and they should include plenty of calcium-rich food and should eat high fiber diet. Now, this high fiber diet helps in regulating the bowel movements, and the patient do not suffer from the problem of constipation, etc., which is very common in the aged group of people. Second thing in the lifestyle which helps is exercise. It helps to control weight, improves emotional well-being, and relieves stress, improves blood circulation, increases flexibility in the body, it lowers blood pressure, increases energy levels, it improves balance, and thus reduces danger of fall, lowers blood sugar level, and thus helps in diabetes, improves bone density, and thus helps to prevent osteoporosis. So, if osteoporosis is not there, then there are milder chances of getting fractured if one falls or gets an accident. Next is weight. Weight is very important to be controlled in aged people, because if the weight is very high, then it makes the life miserable. Obesity is an important factor in heart disease, stroke, hypertension, diabetes, arthritis, and breast cancer. So the weight should always be kept under the control limits. Then smoking. Smoking cessation at the age of 50 years reduces the risk of dying within next 15 years by 50%. So that is how important is to stop the smoking. As early as it is stopped, better it is. Earlier it is stopped, better it is. Risk of developing smoking related diseases decreases even if it is stopped at the late age. Alcohol is again a factor which results in ill health. It is a drug, it is an agent which causes addiction. There is decreased tolerance, it results in liver diseases, the chances of stomach ulcers, gout, depression, osteoporosis, heart diseases, breast cancer, diabetes, and hypertension. So alcohol is very harmful for aged people. Then social activities also play an important role in the lifestyle management. Getting out of the house and keeping involved with others create sense of belonging. So this gives pleasure, and the patient remains more happy if he goes outside, involved in the social activities, in the get-togethers with a similar age group people. So that results in very pleasant feeling in the aged group of people. And mixing with other people of similar age with similar problems can help them realize that they are not alone. It is not only that person who is having this problem, but this problem is very common in this age group. So they should bear this problem happily and should not feel any guilt or any bad feeling for these problems. These are normal problems which comes with the aging. Now, the support gained from others is important in recovering from illness. Then the seventh thing which is very important is prevention of accidents. This is one thing which should be kept in mind whenever we have a patient who is in the age group. I mean, in the geriatric age group. So there are various uh, occasions in which the accidents are very common. The first of such occasion is while getting up from bed. Now, when person is sleeping and when he wakes up and try to come out of the bed. Sometimes he wakes up in the night, in the middle of night from a deep sleep due to the pressure in the bladder, and he feels to go for a washroom or to go to washroom to relieve the pressure. And so he is in a hurry. He immediately gets up and start walking without properly waiting for the body to adjust to. What happens that when a person is in upright posture, means he is standing, the blood of his body comes towards the lower extremities. It tries to collect in the lower extremities, move down in the lower extremities, but there are walls in the blood vessels which hampers from this activity and hampers this activity and prevent the sudden cooling of blood in change of posture. So they close down, so the blood cannot go in the reverse direction. So this thing does not happen. But as the age passes, these walls which are situated in the vessels, they get weaker and they become more sluggish. They work, but they work very slowly. So if a person suddenly starts walking after getting from bed, what happens that the most of the blood of his body cool down in the lower extremity. So there is shortage of blood, or you can say oxygen, in the upper part of body. And as you know, the brain is the most sensitive organ for the this oxygen deficiency. So even if oxygen is not sufficient to for the brain for a fraction of second, the person suffers from the unconsciousness. The brain does not work properly and person becomes unconscious, he falls, and as soon as he falls, automatically he becomes supine, parallel to the ground. So again the effect of the gravity is lost, the blood supply is restored, and again patient gets regain consciousness. But in that sudden fall, usually he get an accident and sometimes his hip bone is fractured, sometimes leg is fractured, sometimes he get head injury, which proves very fatal, sometimes very fatal, and sometimes very crippling for the person who gets it. So one should be very cautious that when he gets up in the night, first he should sit up, become fully conscious, and waiting for 30 seconds or 1 minute. After that, he should hang down his lower extremities below the bed, remain sitting in that posture again for half a minute. Then he should stand up with support, with some thing like bed and or like this, and wait for again for 1 minute. And then when he is stable, then he should start walking. Then this type of accident will not happen. So there is proper precaution which one should take while getting up from bed. Then while walking home also, he should be very cautious, especially if the floor is very glossy and slippery. And when the person is walking, he should walk very cautiously, otherwise he may get fall. So it should be preferred that the floor of the people, aged people, should not be very glazed one. And if it is so, then some carpeting should be done over it so that there are less chances of getting slip and getting an accident. Then while in bathroom, again that is a place where most of the accidents occur, because in bathroom the floor is wet and most of the time the soap etc. is also there. So that makes the floor even more slippery. And uh, when person slips, he struck his head in the wall or in the door or something or in the floor, and that's head injury. And sometimes if he has locked the bathroom from inside, nobody comes to know, and he is not able to get even help afterwards. So we should be very cautious that we should apply the skid tree tiles in the bathroom. And if the aged persons are there, they are using the bathroom, we should cover the floor with rubber matting. Rubber matting is available in the market, which can be applied to the floor, so it prevents the person from slipping. Then there should be some pads or other things, support items in the wall. It should be sturdily fixed in the wall, and the person can take the support. If at all he gets a slip, then he can take support of this brackets or the handles or knobs, etc., and can prevent the fall. Then similarly, while getting up from the toilet seat, the aged people feel very difficult to get up from toilet seat because of weakness of muscles, and usually they are not able to do it. So there should be a support bar fixed by the side of the toilet seat, and the person can take support of that bar, and it should be checked that it is very sturdy and it does not get pointed up when a person takes the support, and person can take the support of this bracket or handle, and then can easily get up. So these type of things are small but very important. Then while walking on road also, these persons should be very cautious that they should not go in the busy hours on the road, and they should walk on the side of the road so that they do not get an accident from the busy traffic, and somebody may not hit them. They should not apply any earplugs or the earphone, etc., or music instrument, etc., while walking on road. And preferably, somebody should accompany them. They should not be allowed to go alone in the while they are going out of the home. And this, if they are at all they are going home, there should be a card placed in their pocket, which should mention the name of the person, the residence, the phone number of that person, and the person who can be called if one gets an accident or he is in trouble. So these things are very helpful if a person somehow unfortunately meets an accident on the road. Then while taking medicine also, one should be very cautious, because these patients are usually forgetful, and they forget whether they have taken the medicine or not. So sometimes they miss the medicine, sometimes they repeat it twice, and suffer from the overdose of the medicine. So both the things are should be avoided. And for this, one medicine planner is available in the market, which contains small chambers. This is a plastic box containing various small chambers. These are labeled with morning, noon, afternoon, evening, and at bedtime, like this. And you can arrange the medicines according to the time of intake, and for one complete week. It also shows the days of the week, like Sunday, Monday, Tuesday, Wednesday, Thursday. So the person can easily check by seeing this medicine planner. He can come to know whether he has taken the medicine for that day at a particular time or not. And if he has not taken, then he can take it. Or if he has taken, then he will find the chamber empty. So he will be saved from taking it twice, and from the bad effects of the overdose of the medicine. So this is also very important. Now, the health status of aged in India, finding the ICMR survey conducted in 1945 of elderly people over 60 years attending geriatric clinics in rural area, they found that the visually impaired complaints and complaints are 88% of the total attendance, and locomotor disorders, joint and muscle disorders were 40%, neurological complaints were 18.7%, cardiovascular diseases were 17.4%, respiratory disorders were 16.1%, skin conditions were 13.3%, gastrointestinal disorders were 9.0%, psychiatric disorders were 8.5%, hearing loss was 8.2%, and benign coronary disorders were 3.5%. So this was the frequency of different types of disorders which we can expect in geriatric age group. Now, areas potentially amenable to preventive healthcare in the elderly. Primary is the, as I have already described, habit, smoking, alcohol abuse, obesity, nutrition, physical activity, and sleep. Then coronary and heart, this disease risk should be factors should be covered. Immunization should be done for influenza, pneumonia, tetanus, etc. And injury prevention. I have already discussed in detail. Then lipogenesis prevention and osteoporosis prevention by proper diet. Then secondary prevention, the screening for hypertension, timely health checkup for hypertension, diabetes, periodontal disease, dental caries, sensory impairment, medication side effects, colorectal cancers, breast cancer, cervical cancer, nutritionally induced anemia, depression, stress, urinary incontinence, periodic problems like fall risk, TB, syphilis, high risk in that, especially in the high risk group, you should be very cautious. Then the stroke prevention and myocardial infarction. So these were the person should be screened for these things for in the group of secondary prevention, so that we can detect these diseases very early and we can manage it and can prevent the complications. But if the person is detected in the late stage, then the tertiary levels of these prevention apply, and these include rehabilitation, that is physical deficit, cognitive deficit, and functional deficit. Then caretaker support is very important in this group, and introduction of support necessary to prevent loss of autonomy. Now, there are geriatric welfare policies, national policy on older persons, a national council for older persons, national social assistance program, and old age social and economic security, OSS, then Indira Gandhi National Old Age Pension Scheme, and Helpage India. These are various welfare schemes which are specially designed for geriatric age group. And there are national policy on older persons. This was announced by the government of India in January 1999. It identifies areas of intervention as financial security, healthcare, nutrition, shelter, education, welfare, protection of life, and property of older citizens. Then it also provides a broad framework for collaboration and cooperation in government and non-governmental agencies, and it also plays a role in active and productive involvement of older persons. A national council for older persons is there. It was constituted to operationalize the policy. Integrated program was formulated by revising earlier system of assistance to voluntary agencies. Objective: promote a society for all ages to empower and improve the quality of life of older persons. Formation of self-help group, association of older persons for advancement of their rights and utilization of their experience services. 234 old age homes and 398 day care centers and 40 mobile medical units are operational. Schemes of assistance to Panchayat Raj institution, voluntary organization, self-help group for construction of old age homes has also been revised to encourage multi-service centers for older persons. Then there is National Social Assistance Program. Old age pension is provided to more than 4 million elderly all over the country. Amount of pension varies from state to state. This is rupees 75 per month in Assam to rupees 300 per month in West Bengal and Rajasthan. It is continuously revising. Recently, it has again been revised and raised. In old age social income security, that is OASIS, it was launched to comprehensively examine policy questions connected with the old age income security. Then travel-related concessions facilities are provided to the older people by Indian Railways, Indian Airlines, and state transport corporations. Healthcare is provided through Bhavish Arogya Mediclaim and rural group or life insurance scheme. Income tax concessions are also available for the aged persons to senior citizens. Various relationships are available. Then Indira Gandhi National Old Age Pension Scheme was launched in 1990 November 2007 to provide monthly pension to people over 65 years and living below the poverty line. The scheme is to cover 1.57 crore people. The central government is to provide a monthly pension of 200 to each beneficiary, and the state governments are expected to contribute an equal amount. And there is Helpage India Society, the largest voluntary organization working for the cause and care of the disadvantaged older people. In the 26 years since its inception, it has made an impact on the lives of nearly 6 million senior citizens through 3,084 projects, supports following programs: free cataract operation, mobile Medicare units, income generation and microcredits, old age homes and daycare centers, adopted that is grandparents, and disaster mitigation. Now, so this was about the healthy aging and taking the care of the aging group. So the take-home message for healthy aging is that we should keep attention towards the nutrition. They should be told what to eat and what not to eat, how to eat, when to eat, and special precautions in chronic illnesses, as I have discussed. Then physical activity is very important, and it is very important to know what and what not to do. Because the capacity or ability of the age group is not same as in the younger age group, so they should also know what they should not do. Then regular health checkups is very important to detect if there is any illnesses in the early stage and manage it and avoid the complication. Then recreation and social life management is equally important besides the physical health. And of course, the precaution to prevent the accidents, as I have discussed in detail in a lecture. So these are the things which one should keep in mind. Thank you very much for patient listening. I hope this lecture will enlighten your knowledge regarding the care of the aged. So this was all for today, and the class superintendent may give the attendance in the. Thank you.